final medication we could talk a bit about for potentially discontinuing is people who go on women who go on an oral contraceptive. So they start this, maybe they have painful cramps and they don't want it to be as painful, or they have some mood irregularities that appear to be cyclical in nature, so they get put on an oral contraceptive. And those can certainly have some side effects and consequences. It's quite well known that they do increase the risk of blood clots, which is why if somebody is a smoker or has other risk factors for a DVT or pulmonary embolism,
yes,
you would be very hesitant to prescribe those things to those patients.
Yes. A good analogy is oral contraceptives are essentially just synthetic HRT. So you're thinking about the effect in all systems of the body. You're thinking about hepatic effects. Since they're oral, the first pass effect, they have very strong activation or agonism of estrogen receptor, specifically in the liver, which increases SHBG, which can decrease free testosterone. It increases your growth hormone binding peptides. It changes a lot of different proteins that are made in the liver, or binding globulins, SHBG being the most well-known, are affected by the action of estrogen in the liver. And then it affects your platelets as well. There has been some studies that have looked at the incidence of VTE, or venous thromboembolism, blood clots, and there is slight differences depending on one, the dose of the estrogen, and now we have more estrogens than just ethinyl estradiol, and also the type of synthetic progestin that's used.
Yeah, so there's still smart prescribing decisions that can be made there for those cases where it is indicated or it does fit with the patient's lifestyle, and there's a lot of power in being able to control when you do or when you do not get pregnant. You talked about estrogen affecting lots of different binding proteins. That's something that we've seen time and time again, the SHBG, even your thyroxine binding globulin. So if you have a menopausal woman on HRT, or she begins HRT and she also has concurrent, say, hypothyroidism, her dose requirement could go up for her levothyroxine or natural desiccated thyroid, whichever she happens to be on. That dose could be increased because she's going to have more proteins binding up that thyroid hormone. It's not going to be getting to the receptor sites any longer.
Absolutely. Just like with hormone replacement therapy, for oral contraceptive prescribing, you can't just be, an expert in one system of the body. You have to be well versed in its hematologic complications and benefits. You have to be well versed in its gynecologic benefits, its obstetric benefits, its mental benefits, its dermatologic benefits, its even intrahepatic circulation of estrogen and the gut microbiome affecting how fast you excrete your estrogen in the stool. So there's benefits in all different systems of the body. So it's hard to say, a lot of people benefit from it. And the other thing that I like to say is there's probably no greater benefit to your health to being able to decide when to or when not to have fertility. So that's going to affect everything else and potentially be in some cases like that, the pros just always outweigh that con because it's such a hefty potential con. So that's the issue, is that so many people need someone to evaluate their hormonal profile while being on contraception, especially oral contraception, and there's just not enough care, there's not enough supply to meet that potential demand.
Yeah, the research really hasn't been done in that area as far as looking. I mean, we have the numbers as far as, okay, we know you start oral contraceptives, this happens to the hormones. So I guess it's a bit incorrect to say the research hasn't been done, but it's not prevalent in, seminars, these events that physicians are attending and getting their education from. They're not saying, hey, if you have, a woman who starts on an oral contraceptive, you're going to see a drop-off in their testosterone. This could be a consideration for student athletes or college athletes, because that certainly can impair your athletic performance. It can also impair your caffeine excretion. So maybe you were always fine when you were drinking Red Bulls before you got started on birth control, and now you get wired, anxious, because you're not going to be excreting that caffeine as well. So every time you put something in, you have one intended effect, and most of the time there's going to be some other off-target effects, whether those are perceptible or not.
That's definitely true. You don't know what you don't know. And a lot of patients, every patient has their own goals. Some do not want to know. They literally just want to go to the doctor and say, "Doc, tell me what to do. This is what my goal is," which is obviously different for every person. "Tell me what to do." And in those cases, we're happy to. Often I like to say, "Hey, do you mind if I just explain a little bit more than we absolutely have to?" But it just kind of depends on the patient. And some patients want that prolonged shared decision-making process, which I think is wonderful as well. It means that they care about their health and what they're putting in their bodies.
Yeah, I think careful consideration is something that's really valuable. We've had multiple studies showing that shared decision-making leads to not only better outcomes, but also better adherence, because the patient, if they had some input into a decision and they understand it, they're more likely to stick to it. It's not just, well, my doctor told me this, so this is what I do. They go and they say, well, we had a discussion about this. We talked about what happens if I don't do this, what happens if I do this, and what are our plans, right? What's plan A, plan B, or what are my different options? So if you're looking at fertility, something like a copper IUD is going to have a negligible impact on your hormone production compared to combined oral contraceptive. So that would be a better choice for someone who wants to maximize their athletic performance. If you have someone who's a Olympic athlete, I highly doubt that they would be taking prescribed oral contraceptives, because that would be more than likely detrimental on their performance.
And if they were, it would probably be the most androgenic one.
That's right, the most androgenic progestin.
Correct.